So, good morning. I'm Alicia Mundy. I'm an author and a longtime editor and reporter on healthcare policy in Washington. With me is Mr. David M. Cordani, and he is the CEO and president of Cigna, the global health service company.
Good morning.
I'm going to start you off with a good morning to you. I want to ask the most obvious question, but why is Cigna sponsoring an event on mental health and well-being?
Sure. So to understand that, you have to put it in the context of our mission. We're a global health service company, and our mission is to improve the health, well-being, and sense of security of the people we serve. We have the blessing and good fortune to have 95 million customer relationships around the world, but we were early on to understand that the connection between mind and body to get the total health equation to work together was critical for the benefit of our customers, working with our healthcare professional partners. So the whole notion of loneliness, mental health, mind-body connection is a critical part of how we orient our business.
Well, that brings us to the next question, which is last month, Cigna launched kind of an unusual study. It launched findings of its loneliness index. What made you decide to actually take on this issue, loneliness, and where are you going with this, with its contribution to mental illness and how we can deal with that for mental health and well-being?
So, I mean, it started with a hypothesis or a hunch. We believe that we were on the precipice of or confronting a loneliness epidemic in the United States. We've seen pockets of that around the world as well, but specifically focusing on the United States. But you don't leap in when you have a hunch or a hypothesis. You have to better understand it. So we partnered up with UCLA. We fielded the largest study of its kind with UCLA and the Prove It methodology, surveying well over 20,000 individuals over the age of 18 to garner the insights, to take the hunch and determine whether or not the facts supported it, and then with the design of the survey to be able to get some quite good insights to be able to guide action and behavior going forward.
So let me ask, I looked through the study, I read the report. There were some, again, unusual findings and a number of negative ones, number of sad ones. What was the most surprising findings for you? Which ones were the major ones, and what was the most surprising?
Yeah, I guess personalize a little bit in terms of the way I process the information. As I said, we started with the hunch, a bit astonished, to breathtaking when about half of Americans correlate themselves in some way, shape, or form to being lonely. So you kind of look left and right with your colleagues, your loved ones, your partners, et cetera, and say, wow. Second is the hypothesis kind of validated back to the challenge in terms of today's youth, or as this survey was looking at, since it started with people 18 years and older, the 18 to 22-year-olds were the loneliest of everybody surveyed, and the senior population was less lonely. So that was a surprise. But bringing back the two punchlines, about 1 in 2, just shy of 1 in 2. And secondly, the younger population feeling more lonely, more disconnected, even with that large base of 1 in 2. And that's pretty breathtaking. So then you step back and determine what are you going to do about it.
Well, there was another finding in there that I think correlated with the youngest group also. Being the loneliest, and that is that they are so involved in social media, and yet one of your findings was kind of surprising on that score. Can you talk about that for a second, the social media? Yeah,
I mean, the correlations in terms of the science or otherwise, there's not a direct correlation that social media equals loneliness, so more social media equals loneliness, but there were correlations that the younger population were utilizing social media much more significantly and happened to be lonelier than the older population that used social media but much less comprehensively and happened to be less lonely. And then ultimately you triangulate that back and look at what are the positives in terms of when loneliness doesn't exist, what occurs from that standpoint.
That was pretty interesting because I expected a different answer on the social media outcome, and it was not there. You have talked before about the bright spots, the importance of community to humans, the importance of social action, the importance of balance. Can you expound a little on that and why those are issues and concepts that a giant health service company would be actually throwing itself into studying?
Sure. So first, from a community standpoint, which I'll come back to, as it relates to the United States, we actually believe that the employer creates these temporary virtual communities. So bear with me for a second, but you have a collection of individuals that come together. around an employer. They become a shared population with a mission, a strategy, goals, different communication, peer pressure, peer support, et cetera. And as it relates to the bright spots or findings, it's pretty clear that individuals who work versus don't work, individuals who have a best friend or a best friend at work tend to be less lonely versus not. Individuals who have more physical activity versus less tend to be less lonely versus not. People who believe that they're obviously contributing back to their community in some way, shape, or form. The way community is defined is very personalized. It could be your literal community, your virtual community, or otherwise. It could be a faith-based community. But again, having something to attach back to that is important to one. Having a best friend. There's a direct correlation if people have a best friend at work versus not. Their level of happiness, satisfaction, et cetera, versus loneliness that correlates up against it. So the bright spots are not unique to the employer, but since half of all Americans get access to their health care through their employer, we see that as a bright spot opportunity to create more belonging, more support, less loneliness, et cetera. And then beyond that, it's the physical health, physical activity. If people are more physically active, less lonely versus more. Some semblance of balance. There's correlation to the level, the amount of sleep people get, to loneliness, et cetera. And then back to being attached to something of belonging, be it faith-based, little community, virtual community, or otherwise.
So you mentioned a number of things that the everyday man can basically do to try and be less lonely, including more activity. Is there anything else that you want to add to this? Because it seems like such a big problem to conquer, loneliness. It's
Sure.
just it's a systemic concept.
Sure.
So what else can the everyday man do?
So, I mean, it's obviously, we believe all healthcare is personal, all healthcare is local. So there's not an easy answer for just do X or just do Y. When you break down the data, when you look at the insights in it, it's ultimately, a lot of it comes back to more human interaction. Societally, in many cases, there's less human interaction by the day or more rushed human interaction. And the human dimension, the social interaction that happens of truly sitting down and having a cup of coffee with somebody and having a conversation, truly a conversation, not distracted every 30 seconds with an electronic distraction or a partial dialogue. It's powerful. It's powerful. And I think a prior individual made a reference to just listening. Mental health professionals would demonstrate, the VA would demonstrate, recovery from surgery, chronic care patients demonstrate time and time again. Having somebody who listens to understand, not to solve your problems, but just listens to understand and feeling like there's somebody there for you. It may sound extraordinarily soft for a global health service company to be oriented around that, but it's that human interaction and the sincerity of it, which is why it requires somebody that you want to spend some time with or interact with at that level.
That becomes one of the issues here, is what Cigna can do for that. And I'm reminded earlier this year, the British Prime Minister Theresa May announced she was going to appoint a minister of loneliness. She got a lot of flack for that being too touchy-feely, yeah. But she was actually looking at the issue of, we know what makes people lonely, we know it affects mental health, what can we do about it? So I saw that Cigna had some kind of interesting ideas it was going to launch, plus some things it had in place. Can you tell us more about what Cigna's doing now?
Just a few. So one, we don't think we have the silver bullet answer to anything. Two, we orient a lot around public-private partnerships. So you start with, when there's an issue, trying to amplify the issue, expand the dialogue, be in a convening capacity. Something like this changes the narrative, and something like this transpiring in multiple forums. Beyond that, we were quite early from an innovation standpoint of integrating mental health and behavioral health resources with physical health resources. For example, if somebody has a chronic illness, of which over 40% of Americans confront some form of a chronic illness, they're 6 times more likely to be clinically depressed than somebody who doesn't have chronic illness. Well, we now know that. What do you do about it? Well, you try to integrate or leverage health coaches, mental health, behavioral health professionals with the medical health professionals to treat the whole person. And you see more positive outcomes. More positive outcomes, not just from an absence of loneliness or depression, but actually better physical health outcomes that correlate with it. Second, we actually stood up a dedicated unit in our company to provide support to veterans. So veterans could access us telephonically, digitally, or otherwise, whether you're a customer or not, whether you have challenges with pain management, PTSD, depression, access to housing, food, clothing, etc., we'll support you. We'll support you from that lens. Integrating community services, working more collaboratively. We have 500 collaborative accountable care relationships in the United States. That means we work differently with medical professionals in a more aligned fashion. In many cases, those are all independent organizations. In many cases, we're embedding physically at the direction and the decision-making of the practicing physicians, nurses, health coaches, behavioralists, social workers, et cetera, to more comprehensively engage the individual to get a better overall health outcome. Those are some examples.
I noticed one of the things you list in there is the call-in line, at least for employees, which goes to the issue of the role of telemedicine, addressing the big issue of can you get someone to listen to you, just having someone listen. And it's pretty clear that you've tried to incorporate that in some of the plans that you're rolling out.
Oh, no doubt. You need, the technical term is modalities. You need a bunch of different access points to be preference-centric. So someone may want to interact digitally, someone may want to interact telephonically, somebody may want to interact eyeball to eyeball. So you need to have the multiple access points, but the common approach is understanding the individual and being present for them. And telemedicine, telebehavioral care, et cetera, is quite powerful.
Okay. I have one final question. We've had government leaders here, public health officials, academics and experts, and we have a lot of people who actually are very, very much involved in advocacy for mental health and for the health community. What's the big takeaway you'd like today, and what would you like to suggest to some of the people to do that would help us succeed in addressing loneliness and could help you and other health service companies
Sure.
do the same?
So I guess a couple points. One is a problem of this magnitude is not going to be solved by any one entity or person or otherwise. Secondly, our country's demonstrated massive power by pulling on the ingenuity and entrepreneurialism, the power of the community and public and private partnerships from that standpoint. So this is a mechanism of amplifying that dialogue. And then lastly, the ability to, again, bring this conversation more comprehensively into the community in terms of every person who's in this room, every government official or otherwise, back to what are local communities doing about this? This will not be solved federally. It will not be solved at a state level. It could be enabled. All of this gets addressed at a localized level because all healthcare is local and all healthcare is personal. So amplify the dialogue, understand the public-private partnership is powerful, be able to pull on some of the bright spots, whether it's through the clinical community, the employer, evolving social programs, and then allow for broader access through, as you indicated, for example, digital health, ensuring that the regulation allows for more digital access and broader access to services.
It's pretty interesting. Thank you, Mr. Cordani. And now I'd like to turn this back to the Washington Post.
Thank you. Thank you all.